recognizing that there is a lot of emotional and political and well, a lot of feelings of different kinds associated with the discussion of this policy, I thought, well, how can I, as an outsider, coming from the frozen north, provide information that would be useful to your deliberations, and that would perhaps provide you with something that you hadn't seen before. And so I looked through the Commission's bibliography to find if our material, for example, had already been considered by the Commission, and I didn't find it there. In fact, I found very little there of an examination of the practical consequences of the healthcare model that they were proposing. Because indeed, the only country in the world that has a healthcare model of the kind which is proposed by the panel is Canada. And so what I'm going to do today is take you through a consideration of, from 2 points of view, of some evidence which I do not believe has been before you as you've been considering this important future for your healthcare system and for your economy. I hope that it will give both you and your government some food for thought as you make what will be an historic decision. Whatever you do, it'll be a historic decision. Now, I have essentially 4 parts to my presentation. The first is, why should you listen to what I have to say? I think it's important for us to get that out of the way. The second is to put healthcare in a broader policy context, because although you're seeming to make a decision about healthcare, in fact, you have to see healthcare policy in the context of broader policy discussions. And then I want to drill deeply into the Canadian healthcare system and to discuss both the myths and the realities of its comparative performance. And then finally to just make a few comments about the futures for Bahamian policy which are contained in the Blue Ribbon panel. Well, why should you be interested in listening to me at all about this or any other topic? Well, I think the main reason is that what is being proposed here is essentially a Canadian model. Now, I've been researching the Canadian healthcare system in various ways since 1978, and for 17 years, my colleagues and I have been actually producing measurements of its performance which are more or less unique. But finally, and most importantly, I think, is that the evidence which we have been compiling over the past 17 years was recently used by the Supreme Court of Canada to find that the Canadian healthcare system as it exists is violating the constitutional rights of Canadians. And they came to that conclusion because of the determination that people's health care was being damaged by the provisions of the program, on the one hand, and secondly, that damage was not necessary to sustain a social, universal, comprehensive insurance program of the kind which the Canadian system has. So in other words, the court said, you know what, the Canadian system isn't working all that well, and the provisions of it which are making it not work all that well are not necessary. And so that's probably the main reason why you should be interested in listening, not only to me, but to others who would come from Canada and give you information about what's actually happening in the Canadian system. Now I'm going to move away from that. That's by way of a teaser, so this is to keep you on the edge of your seat and anticipating what is going to come. I'm going to back away from that now and go into the broader policy question. Because one of the things we recognize is that wealthy people and nations tend to be healthy. This is one of the most widely, I think, accepted ideas now in policy analysis, that you know, wealthy nations are healthy in part because they can afford all of the infrastructure that keeps you know, our inflow separated from our outflow, which is the main problem we have around the world, that people's water intake is being contaminated by their effluent. And so wealthy countries are able to deal with that major issue, and so that's one reason why they tend to be healthier, but also because they can afford to have health care systems that help them when they're not feeling well, and so on. Of course, there is a correlation between wealthy people and healthy people, because for the same reasons they can afford that, but also because perhaps there's something that makes them both wealthy and healthy. And that is a different approach to life. That they have different habits than people who are not wealthy and healthy. And that's something that's very important to take into account, by the way, when you're wondering what you can solve. You know, there are some problems you can't solve. This is one of the things that you learn. I've been in the policy business now for about 40 years, and one of the hardest things and most difficult things to accept is that there are some problems you can't solve. You can't help somebody who doesn't want to be helped. You can't help somebody who has got a bad lifestyle choice, has made a bad lifestyle choice, which is impinging on their health. You can't help that person. You can help them try to make different choices, maybe, but once they've made those choices, you can. So we have to be cognizant of that while we're grappling with this. But let me get to this. Let me get to this logic that I wanted to lay out here. Wealthy people and nations tend to be healthy. Policy can increase the health care access of the less wealthy by taxing the income of the wealthy. If you have a group in your society who want to be healthy and are making healthy choices, but don't have the wealth to get access to health care when their body deals them a trick, or they get a microbe or something, then of course you can solve that problem by helping people who are less wealthy, and you get that money from people who are more wealthy. Now, there's a bit of a problem with that, however, because human and financial capital try to avoid taxes. And the competition for both kinds of capital is global. So that when you're thinking how much money you're going to take from the wealthy to give to the less wealthy, you got to remember that the wealthy don't have to stick around. And in particular, if you're taxing capital to do that, it surely doesn't have to stick around. So, you know, we all recognize that it's a good idea to do some of this redistribution to help people who want to be healthy to stay healthy. On the other hand, you got to watch that other side of it. Nations which attempt to solve the health problem of the less wealthy by taxing human and financial capital will attract less of both. This is now no longer in any dispute around the world. Everybody recognizes everywhere in the world, in the former Soviet Union, in China, everybody in the world now agrees that, yeah, capital moves away and people won't work well if you tax them too much. So therefore, policy which pursues gains in population health without careful attention to the growth and per capita income effects of the methods chosen may produce short-term gains at the expense of long-term losses. And this is very important. So now I'm going to look at the broader, the broader policy context in the Bahamas. Now, how has Bahamian policy been doing generally with regard to this issue of attracting human capital and you know what I mean by human capital, right? I mean somebody who, you know, invests a lot in their education, all that kind of stuff. Do they stay here or do they go to Miami? That's what I'm talking about. Do they decide to stay here or do they vamoose? And that is a, you know, and when of course I don't have to tell you about what we're talking about on the capital side of things. So what we need to do is to assess what the general policy context is in the Bahamas before we get down to drill down to the issue of health policy. Now, for years, the Fraser Institute, in conjunction with institutes in 70 countries, has been measuring policy in about 130 countries. Now, we didn't do 130 countries right at the beginning. We could only measure 80 because there was no data for all 130 at the beginning. But now we're measuring about 94